Many people make errors when checking their blood pressure at home, similar to those sometimes made in doctors' offices. We are highlighting these mistakes because they can produce incorrect results. A falsely high reading may cause you to be misdiagnosed with high blood pressure or to worry unnecessarily. Understanding and avoiding these common errors can ensure you get a precise reading, helping you and your healthcare provider make informed decisions about your health. Placing cuff over clothing. Placing the blood pressure cuff over clothing is incorrect because it can interfere with the cuff's ability to properly detect and measure blood pressure. Clothing creates a physical barrier between the cuff and the skin, preventing the cuff from making direct contact with the artery. This barrier can cause the cuff to not inflate properly or distribute pressure evenly, leading to inaccurate measurements. The presence of clothing can also alter the amount of pressure the cuff needs to apply to occlude the artery. The cuff might require more pressure to compress the artery through the fabric, resulting in a higher reading than your actual blood pressure. Additionally, clothing can cause the cuff to sit improperly on the arm, either too loose or too tight. An improperly positioned cuff can fail to capture accurate readings, either underestimating or overestimating the blood pressure. For these reasons, it is essential to place the cuff directly on the bare skin of your upper arm. This ensures that the cuff can inflate and deflate correctly, applying even pressure and providing a true reading of your blood pressure. 2. Arm not being at the heart level. Taking a blood pressure reading when the arm is not at heart level or when the hand is dangling down is a mistake because it leads to inaccurate measurements. Blood pressure is influenced by the height of the arm relative to the heart due to hydrostatic pressure. When the arm is below heart level, gravity increases the pressure in the arm, resulting in a falsely elevated reading. This can lead to a false diagnosis of hypertension or unnecessary concern about high blood pressure. Conversely, if the arm is above heart level, the reading will be artificially lowered, which might result in undiagnosed or underestimated blood pressure levels. For accurate and consistent readings, it's essential to position the arm at heart level. This ensures the middle of the cuff is at the same height as the heart, providing a true reflection of your blood pressure. Proper technique involves sitting comfortably with your back supported, feet flat on the floor, and the arm resting on a flat surface at heart level. Ensuring the arm is relaxed and supported with the palm facing upward will help achieve the most accurate blood pressure readings, crucial for effective management of cardiovascular health. If you're finding this video helpful, give us a thumbs up and let us know which of this mistake are you guilty of in the comment section below. Also subscribe for more health-related content. 3. Leg crossing. Crossing the legs while taking blood pressure measurements is incorrect because it can lead to inaccurate readings and affect the reliability of the assessment. When the legs are crossed, especially at the knees, it can alter blood flow and circulation in the legs. This change in circulation can result in variations in blood pressure readings. Specifically, crossing the legs can impede blood flow from the legs back to the heart, potentially causing a temporary increase in blood pressure. As a result, the blood pressure reading may be higher than it would be if the legs were uncrossed. Conversely, in some cases, crossing the legs might reduce blood pressure due to decreased peripheral resistance. However, this reduction may not accurately reflect the individual's true blood pressure status. Therefore, to ensure the most accurate blood pressure measurement, it is important to avoid crossing the legs and maintain a relaxed, neutral position during the assessment. This helps to minimize any factors that could artificially influence blood pressure readings, providing healthcare professionals with reliable data for appropriate diagnosis and management of hypertension and other cardiovascular conditions. 4. Conversing while undergoing the check. Talking during a blood pressure check can influence blood pressure readings in various ways. Firstly, engaging in conversation can trigger stress or anxiety responses, causing a temporary increase in blood pressure levels. This elevated state may yield higher readings than the individual's actual baseline blood pressure. Additionally, talking may induce muscle tension and altered breathing patterns affecting blood flow and arterial constriction, further impacting the accuracy of measurements. Moreover, conversation can distract both the individual and the healthcare provider from the measurement process, potentially leading to inconsistent readings. Ultimately, the variability introduced by talking during a blood pressure check complicates the assessment of true blood pressure levels, emphasizing the importance of maintaining a calm, quiet environment for accurate readings. 5. Unsupported back. Poor posture, particularly having an unsupported back, can significantly impact blood pressure readings during measurement. When individuals sit with an unsupported back, they often slump forward, increasing pressure on the abdomen and chest. This compression can hinder lung expansion and reduce thoracic volume, requiring the heart to exert more force to pump blood against heightened vascular resistance. Additionally, poor posture can impede venous return by compressing veins in the abdomen and legs, leading to reduced blood flow back to the heart and subsequently elevating blood pressure measurements. Furthermore, postural changes disrupt the body's natural hemodynamic balance, potentially triggering compensatory mechanisms like increased heart rate and vasoconstriction to maintain adequate perfusion. Incorrect cuff positioning due to slouched posture can also contribute to inaccurate readings. Thus, ensuring proper posture with adequate back support is crucial for obtaining reliable blood pressure readings and facilitating accurate diagnosis and management of hypertension. 6. Cuff too tight. When the cuff is too tight during a blood pressure measurement, it can give a falsely high reading. Imagine wearing a really tight bracelet that leaves marks on your skin. It's uncomfortable and affects the blood flow. Similarly, an overly tight cuff squeezes the arm too much, making it harder for blood to flow through the arteries. This can result in an artificially high blood pressure reading. The cuff should fit snugly around your upper arm, but not too tight. You should be able to fit one finger between the cuff and your arm. Make sure the cuff is positioned correctly on your bare skin with the bottom edge about an inch above the elbow crease. 7. You should be at rest. Resting for 5-10 minutes before taking a blood pressure reading is crucial for ensuring accuracy. This rest period allows the heart rate and blood pressure to return to their baseline levels after any physical activity, as even mild movements can temporarily elevate these parameters. By sitting quietly, the sympathetic nervous system's activity decreases, reducing the transient increases in blood pressure associated with the body's fight or flight response. This rest also helps mitigate white coat hypertension, a phenomenon where anxiety in clinical settings temporarily elevates blood pressure. Furthermore, resting allows for the normalization of blood distribution in the body, particularly in the extremities, which can impact the blood pressure reading. Failure to rest before taking a blood pressure measurement can lead to elevated readings, as the measurement may capture the temporary increases caused by recent activity. This can result in a misdiagnosis of hypertension, potentially leading to unnecessary medication or further testing. 8. Full bladder. Checking blood pressure with a full bladder can significantly affect the reading, leading to elevated results. When the bladder is full, it creates a sense of discomfort and physical stress in the body. This stress triggers a physiological response that can temporarily increase blood pressure. The distended bladder stimulates the sympathetic nervous system, which is responsible for the fight or flight response, causing a rise in blood pressure. Additionally, the physical pressure exerted by a full bladder on surrounding blood vessels can also contribute to an increase in vascular resistance, further elevating blood pressure readings. Therefore, to ensure accurate and reliable blood pressure measurements, it is recommended to empty the bladder before taking a reading. This simple step helps avoid the transient increases in blood pressure caused by bladder distension, leading to more accurate assessments. 9. Taking caffeine or smoking. Consuming caffeine and smoking before taking a blood pressure measurement can significantly affect the results, leading to elevated readings. Caffeine, found in coffee, tea, and some sodas, stimulates the cardiovascular system, causing a temporary increase in heart rate and blood pressure. This effect can last for about 30 minutes to an hour. Similarly, smoking a cigarette causes a spike in blood pressure due to nicotine's stimulation of the nervous system, which results in vasoconstriction, narrowing of blood vessels, and increased heart rate. This effect can also last for about 30 minutes to an hour. To obtain accurate blood pressure readings, it is recommended to wait at least 30 minutes after consuming caffeine or smoking before taking the measurement. This waiting period allows the temporary effects of these substances to subside, ensuring that the blood pressure reading reflects the individual's true resting state rather than the transient increases caused by caffeine or nicotine. Thus, avoiding these substances and allowing adequate time before measuring blood pressure is crucial for accurate and reliable assessment. 10. One One diagnosis method. Relying on a single blood pressure measurement to diagnose hypertension is inadequate because blood pressure can fluctuate due to various factors such as stress, physical activity, diet, and the time of day. An elevated reading at one moment may not accurately reflect a person's usual blood pressure, leading to a potential misdiagnosis. Hypertension is a chronic condition characterized by consistently high blood pressure, not just occasional spikes. Therefore, a more accurate approach involves taking multiple measurements. At each visit, it is advisable to take at least 2 readings separated by a few minutes and use their average. This process should be repeated across several visits, typically spaced weeks or months apart, to account for temporary fluctuations. Additionally, encouraging patients to monitor their blood pressure at home can provide a more comprehensive picture in a less stressful environment. In some cases, 24-hour ambulatory blood pressure monitoring may be used to gather detailed information on blood pressure patterns throughout the day and night. These methods ensure a more accurate and reliable diagnosis of hypertension, helping to avoid unnecessary treatment and ensuring appropriate care for those with sustained high blood pressure. Thank you for watching. Don't forget to give us a thumbs up and see you on the next one.